Imagine for a moment you've just got the lab results back for your horse, let's call her Sparky. You're scanning the numbers right, and one stands out. Lymphocytes, unexpectedly high. What does that even mean? Is it a big deal or just a quirky blip on her health radar? Today, we're doing a deep dive into equine lymphocytosis. Yeah, that's the fancy term for a high lymphocyte count in horses. It can be a bit confusing when you first see it.
Absolutely. And our mission today is really to demystify this for you. We want to break down the different reasons behind it, how vets kind of play detective to figure out the why, and, crucially, what it might actually mean for Sparky's health. We've pulled the key insights from the material you shared, covering everything from, well, genuinely surprising physiological reactions all the way to more serious conditions.
Okay, great. So get ready for those aha moments that hopefully turn a confusing lab number into a much clearer picture of your horse's health. So let's unpack this. Before we dive into what a high count means, maybe start with the basics. What exactly are lymphocytes and why are they so important?
Right. So lymphocytes, they're a really critical type of white blood cell. Think of them as the highly specialized strategists of the immune system. They're central to what we call the adaptive immune system. That's the part that learns and remembers specific threats, like a highly trained intelligence agency for the body. We generally talk about three main types. You've got P lymphocytes, or T cells. They handle cell-mediated immunity. Think of them as the direct combat units killing infected cells, regulating other immune cells. Very hands-on.
Okay, direct action, guys.
Exactly. Then you have B lymphocytes, or B cells. They're responsible for humoral immunity. These are more like the intelligence gatherers, maybe the weapons developers. They differentiate into plasma cells, and those produce antibodies, the specific missiles designed to target invaders.
Gotcha. Antibodies.
And finally, natural killer cells, NK cells. They're actually part of the innate immune system, more like rapid response units. They recognize and kill virally infected cells and tumor cells without needing prior exposure. Very quick. Now, on a standard blood smear, we mostly see T cells circulating, but you can't actually tell B and T cells apart just by looking without special stains.
So they're basically the immune system's special forces, each with a really specific job. Wow, that's quite an elegant system, isn't it?
It really is.
So what's considered normal then for a horse in terms of numbers?
Yeah, good question. For a typical adult horse, the absolute lymphocyte count usually falls somewhere between, let's say, 1,300 and 4,700 cells per microliter of blood, roughly. So when we see lymphocytosis, it just means the count is above that upper limit. Often you'll see it cited as over 5,500 cells per microliter in some resources. But, and this is important, normal can vary a bit. Young horses, especially under 2 years old, they often have higher counts naturally.
Oh, interesting.
Yeah, and things like breed, stress, even recent exercise can nudge those numbers around too.
That makes me wonder then, if these cells are so vital and usually kept in check, what actually makes their numbers, jump up like that?
Well, broadly speaking, it boils down to a few main mechanisms. Either the body is cranking out more lymphocytes,
Yeah.
increased production, or maybe they're not being cleared out as quickly, decreased destruction, or, and this is interesting, they could just be shifting location, moving out of lymphoid tissues like the spleen or lymph nodes and into the bloodstream where we measure them, a redistribution basically.
Right. Okay, and here's where it gets really interesting, I think, for owners.
Yeah.
Because not every high count is bad news, is it? Sometimes it's just Sparky being Sparky.
Exactly, you hit the nail on the head. That's what we call physiologic lymphocytosis, sometimes called redistribution lymphocytosis, and often it's super transient, like less than 30 minutes, it's gone.
30 minutes, that quick.
Yeah, really quick, the common trigger, acute stress, excitement, maybe even fear. Think about Sparky arriving at the vet clinic.
Yeah, but jumpy maybe.
Totally.
Mm.
Jumpy during the blood draw. What happens is a rapid release of stress hormones, adrenaline, or epinephrine, technically. This makes the spleen contract, and it literally squeezes out lymphocytes it was holding. Plus, it pulls lymphocytes off the walls of blood vessels into circulation.
Wow.
High-intensity exercise can do something similar. And this whole thing, it's particularly common in young horses under 2. Their counts can shoot up maybe even to 15,000 cells per microliter. Often you see neutrophils go up too.
So that jumpy moment at the vet can literally change the blood work just from nerves.
Precisely. It's a physiological response, not disease.
That's wild. I wouldn't have guessed that connection was so direct. Okay, so what about when the immune system is actually, fighting something off?
Right. That's the next category. Antigenic stimulation, or sometimes called reactive lymphocytosis. This is different. This is the immune system's sustained, deliberate response to a real threat, a pathogen usually. You see this commonly in chronic viral infections, things like EIA, equine infectious anemia, or the later stages of equine herpes virus, EHV. Less commonly, maybe chronic bacterial or fungal infections, especially the ones that cause ongoing inflammation, can stimulate this lymphocyte increase too. Even some chronic parasites or larval migrations might trigger it. And you can see a temporary bump right after vaccinations. Makes sense, right? Introducing new antigens.
Yeah, the body's learning.
Exactly.
Yeah.
Now, when a vet looks at the blood smear in these reactive cases, they're looking at the cells themselves, not just counting. Reactive lymphocytes, the ones responding normally, they might look a bit larger, maybe have darker blue cytoplasm, sometimes irregular shapes. But the key thing, they are typically heterogeneous,
Heterogeneous, meaning?
meaning they look varied, different sizes, different shapes, kind of like a diverse, busy crowd. It shows a healthy, active immune response is happening, not just one type of cell cloning itself over and over.
Okay, that makes sense. A diverse response is a healthy response. So physiological or reactive generally means the body's just doing its job, or reacting normally to something temporary, or maybe an ongoing challenge it's handling. All right, so that covers the, let's call it the good news or expected reasons for a high count. But what about the times it signals something more worrying? Let's move to the reasons that need closer attention.
Indeed, and this is where we get into the most concerning cause of a significant, persistent lymphocytosis. That's neoplasia,
Yeah.
cancer, essentially, specifically malignant lymphoproliferative disorders. This umbrella includes a few key things. First, lymphoma. That's a cancer of lymphocytes that can start in lymphoid tissues, lymph nodes, spleen, or even outside of them. If those cancerous lymphocytes spill out into the blood in large numbers, we call that a leukemic phase of lymphoma.
So lymphoma isn't always in the blood, but it can be.
Correct. Then there's leukemia itself, specifically lymphocytic leukemia. This is a primary cancer of the bone marrow, where it just starts making uncontrolled numbers of lymphocytes. And within leukemia, we usually differentiate between two main types in horses. First, chronic lymphocytic leukemia, or CLL. This is generally seen in older animals. It involves lymphocytes that look quite mature, but there are just way too many of them. It's often slow progressing. Sometimes animals can be asymptomatic, show no signs for a long time, but wow, the counts can get incredibly high, up to 250,000 cells per microliter sometimes.
250,000, just lymphocytes.
Yeah, it can be really dramatic on paper. Then the other type is acute lymphocytic leukemia, ALL. Less common, thankfully, but much more aggressive. This involves very immature lymphocytes called lymphoblasts. It progresses rapidly, it's severe, and often comes with really serious clinical signs. And because it starts in the bone marrow, it often crowds out the production of other cells, leading to pancytopenia, shortage of red cells, white cells, platelets, everything. And just briefly, multiple myeloma, a cancer of plasma cells, can sometimes have a lymphocyte component too.
Wow. The difference between CLL and ALL sounds like, well, like night and day in terms of how they
Yeah.
present and the immediate impact.
They really are.
Yeah.
Very different clinical pictures and urgency. And while cancer is the big worry with persistent high counts, it's worth mentioning briefly that some other chronic inflammatory or immune-mediated diseases can sometimes cause ongoing antigenic stimulation and lymphocytosis, though usually not to those extreme leukemia levels.
Right. So, okay, Sparky's blood test comes back, lymphocyte count is high. How does the vet start playing detective to figure out which of these paths we're on, what's in their toolkit?
It's definitely a step-by-step process. It absolutely starts with the basics.
Right.
The clinical history and a thorough physical exam. That's foundational. The vet needs to know, is this a new finding or has it been high before? Are there any clinical signs? Fever, weight loss, lethargy, not eating well. They'll carefully feel the peripheral lymph nodes. Are they enlarged? That's lymphadenopathy. Check for an enlarged liver or spleen. And age is a big clue, right? A young horse with a high count might just be physiologic. An older horse with a persistently high count. Neoplasia moves up the list.
Makes sense.
They'll also ask about recent exposures, travel, new horses, any medications, especially making sure the horse hasn't had corticosteroids, because those usually lower lymphocyte counts, causing lymphopenia. So connecting that high number to the bigger picture, Sparky's overall health, what the vet can actually feel and observe, that tells a huge part of the story right away.
Okay, history and physical first, then labs.
Then labs. The complete blood count, the CBC with differential, is ground zero. The absolute lymphocyte count itself confirms the finding. But here's a really critical step. Automated analyzers give us the numbers fast, but they should always be confirmed with a manual blood smear review by someone trained, ideally a veterinary clinical pathologist or hematologist.
Ah, okay. So the machine counts, but a person needs to look. Why is that manual look under the microscope so vital? What's the biggest gotcha a machine might miss?
Exactly. The biggest gotcha is morphology, the appearance of the cells. The machine counts, but it doesn't really interpret what the cells look like. That manual review is where you see it. Are the lymphocytes reactive? Maybe a bit larger, more basophilic cytoplasm, varied shapes, that heterogeneous look we talked about, that points towards immune stimulation.
Yes, look,
Healthy response.
diverse crowd.
Or do the lymphocytes look abnormal? Maybe they're very immature. We call those lymphoblasts, large cells, funny-looking nucleus, not much cytoplasm.
Yeah.
Or maybe they just look weird, atypical. And crucially, do they all look disturbingly similar? That homogeneous appearance, that's a massive red flag for a clonal population. Cancer. The machine just can't make that judgment call reliably.
That's fascinating. The difference between a varied crowd and a uniform army,
A
essentially.
very good analogy. And other CBC clues help too. Is there neutrophilia alongside it?
Yeah.
Suggests inflammation, infection, or neutropenia. Maybe severe infection, or possibly all messing with the bone marrow. Anemia, low platelets. Again, raises concern about bone marrow function, especially with aggressive leukemias. Even changes in monocytes or eosinophils can add pieces to the puzzle.
Okay, so the CBC with manual review is huge. What other tests might come into play?
Several others can be really helpful. Acute phase proteins, things like fibrinogen or serum amyloid A, SAA. If these are elevated, it tells you there's significant systemic inflammation going on. Helps distinguish that simple excitement spike from real disease. Serum protein electrophoresis, or SPE. This looks at the different protein fractions in the blood serum. A high level of globulins, especially if it shows up as a narrow, sharp spike, what we call a monoclonal gammopathy, is highly suspicious for plasma cell cancer, or some B-cell leukemias or lymphomas. It means one clone of cells is pumping out tons of one specific protein. Big red flag.
Versus a broad increase.
Right. A broad polyclonal increase suggests more general chronic immune stimulation, like from infection. And then, of course, specific infection tests. The Coggins test for EIA is absolutely essential in pretty much any workup like this, depending on signs and location. Maybe test for EHV, West Nile virus, others.
Okay, that covers a lot of ground. What if, after all that, cancer, neoplasia is still high on the suspect list? What are the more advanced steps?
Yeah, if neoplasia is strongly suspected, we move into more specialized advanced diagnostics. And what's fascinating here is how these tools let us really fingerprint these lymphocyte populations. Flow cytometry is a big one. It uses lasers and antibodies to identify specific markers on the surface of the cells. This tells us their immunophenotype. Are they T cells, B cells, NK cells? And crucially, it helps determine if the population is clonal, meaning likely neoplastic, all arising from one bad cell, or polyclonal, which points more towards a reactive process.
So it's like identifying which branch of the special forces they belong to and if they're all identical copies.
Pretty much, yeah.
Yeah.
Another powerful tool is the PCR for antigen receptor rearrangements, the PAR assay. This looks at the genes that code for immune receptors on lymphocytes. In a normal reactive response, you have lots of different rearrangements because many different cells are responding. In cancer, because it starts from one clone, you see one dominant rearrangement pattern. It's a very strong indicator of neoplasia.
Molecular detective work.
Exactly. Then, if we're worried about bone marrow involvement, especially if other blood cell counts are low, a bone marrow aspirate or biopsy is key. We look for infiltration by those neoplastic cells. And ultimately, for diagnosing lymphoma definitively, a biopsy of affected tissues like an enlarged lymph node, maybe a suspicious mass found on ultrasound in the abdomen or chest, or even skin or gut biopsies if lymphoma is suspected there. Histopathology, looking at the tissue architecture under the microscope, is the gold standard for lymphoma.
You mentioned fine needle aspirates aren't always enough.
Right. Fine needle aspirates, just sucking out some cells, can sometimes be suggestive, but often for lymphoma, you really need a piece of tissue, a biopsy, to see how the cells are arranged and confirm the diagnosis. And don't forget diagnostic imaging. Ultrasound is huge for looking inside the chest and abdomen for enlarged lymph nodes, organomegaly, masses. Endoscopy can be used to find and biopsy gastrointestinal lymphoma.
Okay, that is a comprehensive toolkit. So once that meticulous detective work finally nails down the cause, what's the path forward for Sparky? What does treatment look like? And maybe most importantly for owners, what can they expect for their horse?
That's the critical point, isn't it? Treatment is always directed at the underlying cause. The lymphocytosis itself, the high number, that's just a lab finding, a symptom. It's not the disease we treat directly. So for those physiological cases, the stress response. No treatment needed. It resolves on its own once the horse calms down.
Right.
For reactive cases where the immune system is fighting something, you treat the something. Antivirals if possible, antiparasitics, antibiotics if there's a secondary bacterial infection, maybe anti-inflammatories to help manage the response, address the primary issue, and the lymphocyte count should normalize.
Okay, straightforward enough for those, but what about the neoplastic causes? Leukemia, lymphoma?
Yeah, that's where it gets much more complex and serious. This usually requires aggressive, specialized treatment, primarily chemotherapy. For chronic lymphocytic leukemia, CLL, if the horse is showing clinical signs, remember, sometimes they're asymptomatic, then treatment often involves prednisolone. That's a corticosteroid, but it has lympholytic effects, meaning it helps kill lymphocytes, which is actually useful here.
Using a steroid to kill immune cells. Interesting twist.
It is. It's often used alone or sometimes combined with an oral chemo drug called chlorambucil. Other chemo agents might be considered too. For acute lymphocytic leukemia, ALL, that needs really aggressive multi-drug chemo protocols. But honestly, the prognosis, even with treatment, is generally quite poor. It's a very tough route.
And for lymphoma that's gone leukemic.
Similar situation, combination chemotherapy, usually tailored to the specific type and stage of lymphoma. And alongside chemo, supportive care is absolutely vital. Blood transfusions if there's severe anemia or low platelets, antibiotics to fight off secondary infections because the immune system is compromised, nutritional support, just managing symptoms to maintain quality of life. Radiation therapy might be an option for localized lymphoma, like a single tumor, but not really for widespread leukemia. And newer things like immunotherapy are mostly still in research stages for horses. One important practical note. Handling cytotoxic chemotherapy drugs requires careful safety precautions, proper personal protective equipment for anyone administering them. And vets have to be cautious with steroids if there's any hint of underlying infection or laminitis risk.
Right, safety first. Okay, so the big question hanging over all this. What's the outlook? What's the prognosis for a horse like Sparky, depending on what caused that high lymphocyte count in the first place?
Yeah, the prognosis really hinges entirely on that underlying cause. It varies dramatically. For physiological or reactive lymphocytosis, prognosis is excellent. These are generally benign situations. They resolve spontaneously or once the primary infection or inflammation is dealt with. Good news there.
Okay, that's reassuring for those cases.
But for neoplastic lymphocytosis, leukemia, or lymphoma, the prognosis shifts to guarded to poor, generally speaking. For CLL, chronic lymphocytic leukemia, it's usually considered guarded. But the key here is that it can often allow for quite long survival times, months, sometimes even a few years, often with a good quality of life, especially if it's caught early and treated appropriately when signs appear. It's rarely considered curative, but it can often be managed for a significant period. And remember, some CLL horses stay asymptomatic for a long time, even without treatment.
So CLL is serious, but maybe not an immediate crisis, depending on the horse?
Often, yes. Contrast that with ALL, acute lymphocytic leukemia. Prognosis there is grave. It's typically rapidly progressive. Even with aggressive chemo, survival times are often measured in weeks to maybe a few months. It's unfortunately a very difficult diagnosis.
That's tough.
And for lymphoma with the leukemic phase, the prognosis is highly variable. It depends hugely on the specific type of lymphoma, where it is, the grade, the stage. But having that leukemic phase often signifies a more aggressive or advanced stage. So it generally carries a more guarded prognosis compared to lymphoma that hasn't spread to the blood like that. Other factors influencing prognosis in cancer cases include, obviously, the specific type, how widespread it is, whether the horse is already showing clinical signs symptomatic usually means poor outlook, how they respond to chemo, because relapse is common, and frankly, the owner's resources and commitment to potentially long-term intensive care play a role too.
That makes sense. A lot of factors involved in those tougher cases. So bringing it all together then, what's the main takeaway for you, the horse owner, listening to this?
I think the main takeaway is that lymphocytosis, a high lymphocyte count, is a laboratory finding that absolutely demands careful interpretation. Don't panic, but don't ignore it. While it's often just physiological stress or a sign of a routine immune response, it can also be a really critical early warning sign of serious underlying disease, especially cancer. A thorough diagnostic workup, guided by your veterinarian, is just essential to pin down the precise cause. Only then can you make informed decisions and establish the best path forward for your horse's health and well-being.
Absolutely. And maybe this raises an important final thought. Next time you get that lab report back for your horse and you see a number like the lymphocyte count, even if it seems small or technical, what deeper stories about their health, their immune system, their resilience, what deeper stories will you be ready to explore, looking beyond just the raw data?